Welcome to the topic Pain and Fever Pharmacology. Pain assessment is always the first step to manage the pain. So starting from 0 to 10, we can tell if a person is having no pain or up to mild, moderate, severe, very severe, and worst pain possible. So we ask the patient how much pain you are feeling, rating from 0 to 10, and then we assess accordingly. Pain is actually a physiological and emotional experience. It can be acute or chronic. If it's an acute, then the tissue injury is involving nociceptor, that is the receptor, which responds well to the conventional pain medications. And it can be a neuropathic pain, which is a chronic pain, and it is a direct nerve injury and more difficult to treat. In the pain assessment, the first step is in the pain management to guide the treatment. Then we have to find the several numerical scales and survey instruments are available for them. And the correct therapy is always dependent on the pain nature and the character. There are some non-pharmacological techniques. They assist the patients in obtaining the adequate pain relief. Like non-pharmacological pain management includes acupuncture, biofeedback therapy, massage, heat or cold packs, meditation, relaxation therapies, art or music therapy. Other than that, we can do imagery, we can use chiropractic, we can use hypnosis, therapeutic touch, transcutaneous electrical nerve stimulation, which is also called as TENS, and energy therapies such as Reiki and Qigong. Other therapies include the radiation therapy, like which shrinks the solid tumors that may be pressing on the nerves. We can do the surgery for the pain, which reduces the pain by removing the part of or the entire tumor. We can use the nerve block, that is injection or alcohol or other neurotoxic substances into the neuronal tissue, irreversibly stops the impulse transmission along the treated nerves. The knowledge of the pain transmission processes allows for identifying several targets for pharmacological intervention. And the targets includes nociceptors, which are kind of receptors. They're present at the free nerve endings located throughout entire body. There are several targets where the medications can work. And the two main classes of the pain medications are, number one is the non-steroidal anti-inflammatory drugs, which is called as NSAIDs, NSAID. They act at the peripheral level. And the other are the opioids, which act within the CNS. Now here we can see the neural pathway for the pain, in which this is a substance P, which is going to act on the receptor for the substance P, and which is here, it is a receptor for the opioids, serotonin or norepinephrine. Now what happened when we have on the free nerve ending, like on a finger, you got a pain, you heard. So that pain will transmit from here. It goes to your spinal cord. Over there, it is the ascending pathway to the brain. It's going to the brain. Now, in the brain, it goes over here and it acts on these and then results as an descending the inhibitory endogenous opioid serotonin norepinephrine neuron coming down from the brain. So that's how the neural pathway goes. The pain transmission goes to the spinal cord, then goes to your brain. From the brain, it acts how it has to be, and then it comes back to the spinal cord and goes back to your nerve endings. Now, if we talk about the opioid analgesics, these are the medications that exert their effects by interacting with the specific receptors. Like opioids can be natural, they can be synthetic or morphine-like substances. They are always responsible for reducing severe pain, and the narcotic substances produce the numbness in the body or the stupor-like symptoms as well. The drug of choice for moderate to severe pain that cannot be controlled with other classes of analgesics, so we use opioids for them. Now, if we talk about receptors, the responses produced by the activation of the specific opioid receptors, which includes mu receptor and kappa receptor. So there are two kinds of receptors in the body. What happened with the response? Analgesia response goes at the mu receptor and kappa both. Decreased gastrointestinal motility acts on the mu receptor and kappa receptor. Euphoria is only because of the mu receptor. Meiosis, which is constricted pupil, only acts on the kappa receptor. Physical dependence is on the mu receptor. Respiratory depression is that they're working on the mu receptor, sedation, mu receptor, and kappa receptor. It means if we are giving a drug which is going to act on the mu receptor, will show all these responses. And if a drug is given in the body which is acting on the kappa receptor, it will show the responses as it is shown here. Now we also say these opioid receptors, the opiates, they stimulate or block the receptors. Now the first one here is the pure opioid agonist. For example, morphine and codeine. You can see it has a specific shape in which they have to go like a lock and key hypothesis. Then there is a mixed opioid agonist which can be used as a buprenorphine. Then mixed opioid agonist, that is pentazocine and butorphanol, it can be used. Another pure opioid antagonist is naloxone. So we have these kinds of the drugs, they go on to the active on the receptors. Now again, we didn't like the mu and the kappa receptors. If they are this one, they are going at the mu receptor, they are causing analgesia effect, they're decreasing GI motility, they're doing respiratory depression, they are giving sedation, and they are making the physical dependence. So now we can remember this thing, any morphine or codeine containing drugs, they are always pure opioid agonists. They always act on the mu receptors. If they are acting on mu receptors, so morphine and codeine will always give the analgesia effect. They will always decrease, they will do respiratory depression, they will do sedation, and they will also do the physical dependence of that drug. So morphine, codeine, and buprenorphine, these three drugs. Then if we see which drugs are going to act on the kappa. So kappa receptor, it's pentazocine, butorphanol, morphine, and codeine as well. So they are acting on both receptors. So pentazocine and butorphanol, these are the only two drugs which do not cause the physical dependence. But other than that, if they are acting on kappa, they are showing analgesia and decreased GI motility action, but not respiratory depression and no physical dependence for this drug. And naloxone doesn't come on any mu or kappa receptor. So naloxone is always an antagonist. It is given as an antidote for these drugs if it's taken in an overdose. Now, narcotic opioids, they have the multiple therapeutic effects, including relief of the severe pain. What are the other effects of opiates? Severe pain relief, they suppress the cough reflex, slow GI motility, and sedation. If any prescription comes to you and they are asking for opiates, it doesn't mean they're only for pain. They can be also for cough reflexes. If a person has a very bad cough, so opiates can be given to them. They also decreases the GI motility. If a person is having a severe diarrhea, then the opiates can be recommended to them. But they also have adverse effects. They cause the respiratory depression, sedation. They also causes nausea and vomiting as well. Now we have some drugs called as patient-controlled analgesia, which is delivered with the infusion pump. The limits are set to prevent the overdose, and the patient self-medicates by pushing the button. That's why the patient can stop by itself. If the pain is more, they can push the button. If the pain is less, they can release the button. That's called as patient-controlled analgesia. Now we have some combination medications as well, like the combination of the opioids and non-narcotic analgesics. They can be in one single tablet or capsule. They work synergistically, like they work combinedly to relieve the pain. And the dose of narcotic always be kept small. They always minimize the adverse and the negative effects when we give them in a combination. So what are these popular combination analgesics? For example, Percocet, which includes oxycodone hydrochloride, 5 milligrams, acetaminophen, 325 milligrams. Percocet Demi, that is oxycodone 2.5 milligrams, acetaminophen 325 milligrams. We have Percodan, oxycodone 4.5 milligrams, then oxycodone, another salt, terephthalate 0.38 milligrams, and aspirin, which is a non-opioid, it is a 325 milligrams. Then Tramacet is tramadol 37.5 milligrams and acetaminophen 325 milligrams. Then we have Tylenol with codeine. Single dose may contain from 8 to up to 60 milligrams of codeine phosphate, 65 milligrams of caffeine, and 325 milligrams of acetaminophen. So you will be remembering the names Percocet, Percocet Demi, Percodan, Tremacet, and the Tylenol with codeine. Next, we have the opioid antagonists. That was the substances that prevent the effects of the opioid agonists. They are always the competitive antagonists, and they compete with the opioid agonists for access to the opioid receptor site. The acute opioid intoxication is a medical emergency, and it helps for the respiratory depression. The drug is the naloxone, which is also called as Narcan. This is an antidote for the opioids. Now, some opioids with the mixed agonist or the antagonist activity, they stimulate the opioid receptors, causing analgesia. They also do some withdrawal symptoms, and they also have some adverse effects. They include the withdrawal symptoms. Adverse effects are not as intense when we are using the mixed agonist and antagonist. And the partial activity of the receptor subtype occurs. For example, methadone, which is also called as dolophine. So methadone is also nowadays can be used for the reverse of the opioids, withdrawal of the opioids. So it is actually a mixed agonist and antagonist activity. It always treats the opioid dependence. Then we have inflammation as a body defense that limits the spread of invading microorganisms and injury. So inflammation is a natural process which occurs due to the different stimuli, physical injury, toxic chemical responses, extreme heat, invading microorganisms, and the death of the cell can cause the inflammation. The purpose to contain injury or destroy the microorganisms to facilitate the repair, and the signs include for the inflammation is the swelling, pain, warmth, and the redness to the affected area. Body reacts to the injury by releasing the chemical mediators that cause the inflammation. What are these chemical mediators? Number one, bradykinin. It is present in an inactive form in the plasma and the mast cells. Vasodilator that causes the pain, and the effects are similar to those of histamine. Then we have a complement mediator. It is the series of at least 20 proteins that combine in a cascade fashion to neutralize or destroy an antigen. Then we have histamine mediator, which is stored and released by the mast cells in the body. It causes dilation of the blood vessels, smooth muscle constriction, tissue swelling, and itching. Then we have leukotrienes, which are stored and released by the mast cells, and effects are similar to those of the histamine. Then we have prostaglandins. They're present in most tissues. They're stored and released by mast cells, increase the capillary permeability, and they attract the white blood cells to the site of inflammation, and they cause pain. Now, this inflammation can also be treated with non-pharmacological and pharmacological therapies. Now, how we treat inflammation? Number one, the cause should be identified, that what is the underlying cause for the inflammation. Only then we can treat them. Mild symptoms, then we can use ice and we can use rest when possible. Use of topical drugs when applicable. Fewer adverse effects for that, but not too much. And the inflammation of the skin and the mucous membranes of the mouth, nose, rectum, and vagina. Best treated with the topical medications, and many of which are OTC. You don't have to get any prescription for that. Now, non-steroidal anti-inflammatory drugs. These are the drugs of the choice for the pain caused by the inflammation. So these NSAIDs, these are nothing but the antipyretics used for anti-fever. They also have anti-inflammatory effect. They have analgesic effect, which is a pain-reducing property. And this is the drug of choice for mild to moderate pain associated with inflammation. If there is no inflammation, then we can use the opioids. They act by inhibiting the pain mediators at the nociceptor level. Now, COX inhibitors. What is the COX inhibitor? It blocks the formation of prostaglandins. What are prostaglandins? These causes the pain. They are formed by the cyclooxygenase type 1, that is COX-1, and cyclooxygenase type 2, that is COX-2. Aspirin inhibits both COX-1 and COX-2. When COX is inhibited, inflammation and the pain is reduced. So whenever the prostaglandins are released, the COX is released, we give the NSAID, that is in, for example, aspirin. They inhibits COX-1 and COX-2. Prostaglandins are inhibited and the pain is reduced. Now, COX-2 enzyme selective are, they're more specific for pain and inflammation. COX-2 inhibitors, they're developed for the specific pain relief, and the Celebrex or celecoxib, it is the name of the drug which is only remaining selective agent as a COX inhibitor. Now, how they act in an acute inflammation, here we can see a cellular injury occurs. What helped to the mast cell? The mast cell will release the chemical mediators like histamine, bradykinin, complement, and leukotrienes. Anything, let's say you hurt your finger or you hurt something, your body part, then your mast cells will be released and these mediators will be released. What will happen? They will cause the vasodilation. Vessels will be dilated. So redness and heat will be occurred. Vascular permeability will occur, which will cause the swelling, which is called as edema. Then the cellular infiltration occurs, the pus will be formed. Thrombosis will occur, the clots will be formed. And the stimulation of the nerve endings, that will cause the pain. So whenever you hurt anywhere, all these steps go because of the release of these chemical mediators. Now, the drug we know about the acetaminophen, which is one of the NSAID, very common NSAID. It is a non-opioid analgesic. It is not classified as particular NSAID, but it is equally effective as aspirin and ibuprofen. It is also used to reduce the fever, which is also called as Tylenol. Then we have some centrally acting drugs like tramadol, which is also called as Ultram. Weak opioid activity and not thought to relieve the pain by this medication. Fever is nothing but a natural defense mechanism of the body. It itself not harmful. Raising the body temperature makes it more difficult for bacteria and other pathogens to survive. Medications are not indicated for low-grade fevers if you have below 38.4 degrees Celsius, and acetaminophen or ibuprofen can be used for the fever. The goal is to provide the patient comfort. Headaches can be effectively treated with different drug classes. Like headache is one of the most common complaints of the patients. The tension headache is the most common. Migraine is the most painful type of headache. And the goals for the pharmacological management is stop the migraines in progress and prevent the migraines from occurring back. That is called as the prophylaxis. The drugs that we use for the migraine is, number one, the classification is triptans. They are selective for 5-HT1 receptor subtype, and they act by constricting the certain vessels within the brain. If you remember, we see in the picture before that when there is a pain, the vasodilation occurs. Vessels dilate. So we need a drug which can constrict the vessels. So this is the triptans, which constricts the vessels within the brain. Then we use ergot alkaloids. They interact with your adrenergic receptors, your dopaminergic receptors, and serotonin receptors. And they produce multiple actions and the adverse effects. Other drugs can be beta adrenergic blockers, calcium channel blockers, antidepressants, and anti-seizure drugs. Now, what are the key drugs to control the pain and fever? 5-HT agonist triptans or migraine terminations, for example, rizatriptan, sumatriptan, solmitriptan. Anti-seizure or migraine prevention drug is divalproex. Beta blocker, migraine prevention is propranolol. Calcium channel blocker used for migraine protection is verapamil. Cyclooxygenase type 2 inhibitor, COX-2 inhibitor is celecoxib, and ergot derivative for the migraine termination is the dihydroergotamine. Then we have mixed narcotic agonist or antagonist, which is pentazocine, which was acting as a kappa receptor. Narcotic analgesic, for example, acetaminophen, codeine, and caffeine combinations. Codeine alone, fentanyl, hydrocodone, hydromorphone, meperidine, morphine, and oxycodone. We have narcotic analgesics, which is used for narcotic dependency, which is the methadone. You remember we did, it is a methadone. It's an opioid agonist antagonist mixed compound, which is used for the withdrawal or the dependency. Then we have narcotic antagonists or blockers, which is naloxone, which is an antagonist of the opioids. Then we have neuropathic analgesics, which are GABA derivatives, pregabalin, which is used for nerve pain, and NSAIDs like acetyl salicylic acid, which is called as aspirin, ibuprofen, which is Advil or Motrin, naproxen, which can also called as the naproxen. Then we have para-aminophenol derivatives, that is acetaminophen, which is Tylenol or Tempra. We can use the tricyclic antidepressants as well for migraine prevention. For example, amitriptyline drug, which is Elavil. Then we also use the weak opioid agonist, tramadol, and the tramadol with the acetaminophen. So now in this chapter, we understand about how assess the pain and consider the non-pharmacological techniques. Pharmacological intervention is based on understanding of the pain transmission, and the opioids interact with certain receptors and treat the severe pain. And inflammation and fever are the natural defense mechanisms in the body. Also, both inflammation and fever can be treated with the medications and the non-pharmacological therapies, and NSAIDs are indicated for the treatment of the inflammation, and headaches can be treated with different drug classes and benefit from the prophylactic treatment. Thanks for watching.